Hi, this is Dr.RUkmani Choudhary and you are watching Dr.RUkmani's Health Update. In this video, I'll be talking about Blepharospasm. So, inform you all about Blepharospasm, like what is the condition, how it is associated with other eye neurological disorder, what are the stimuli, triggers, risk factors, causes for this condition, what are the signs or symptoms, how we diagnose this problem, what are the diagnostic criteria, best effective homeopathy medicine and allopathic treatment. I'll be talking about Botox, botulinum toxin. So you are requested to watch video for complete information. If you are watching for the first time, to subscribe my channel and press the bell icon to get notified. The first definition, what is Blepharospasm? See, blepharo is the word that is used for the eyelid, and spasm means the involuntary twitching, involuntary contraction means you cannot control on all these movements. These are called spasm and twitching. In these cases, you have involuntary means there is no you don't have any control on these movements, and yes, there is a twitching, spasm, movements of your eyelids, and with the time it can get worsened. With the time there's a complete closure of the eyelid and eventually you have functional blindness. This is a neurological disorder in which you have involuntary twitching, spasm of your eye. Is there any exact cause? What are the triggers? What are the stimuli? So we'll talk about the stimuli, the triggers that aggravate this condition, and the causes, the most believed theory we'll talk about. So the first thing is that this cause for this condition is not known, so there is no exact cause known, but yes, some researchers, some theories that yes, it can be the combined effect, the conjunction, like there is environmental factors, and with the conjunction there can be certain genetical gene changes. So they speculate these theories, and yes, it is also believed that there is a malfunctioning of your basal ganglia in your brain. These are the deeper seated tissues that responsible for the sensation for the eye. So if there is a malfunctioning of these tissues, they lead ultimately to this condition. It is again believed no direct cause, and certain injury, trauma and trauma are believed, but again no direct. And at times it is also believed that it runs in the family, and at times it is related with certain eye disorder with after abusing or overusing of certain drugs. These certain causes to believed, no direct cause, and at times there are triggers. There are certain stimuli like pollution in the environment, there is a wind flow, air pressure, and yes, there is a bright light is also blamed for that. And when you read, when you watch TV for a longer duration, so reading, watching TV and doing jobs on the computer, so they can they work as a stimuli, they can worse your problem. Sign or symptoms. Blepharospasm is also benign essential blepharospasm, and you usually have it in your 30s, 40s. This is like blepharospasm, and usually you have it in your 30s, 40s and your 50s. You have, that's why it is also called adult blepharospasm. Signs or symptoms will completely depend on the condition of your disease. Initially, you have frequent blinking of your eye. Frequent blinking leads to eye heaviness, irritation, eye pain at times you have, and yes, frequent blinking, voluntary narrowing of your vision. So that's why you have functional vision loss, means you are having the narrowing of your vision path, and there's a frequent blinking, and there's a frequent contraction. You have tired, you are irritable. It is very difficult for patients to open. It is very hard to open completely closed. There is a point when your eyelid is completely closed. So yes, there is a blindness, and this is not the internal, this is the functional blindness, means you are having closure of your eyelid, complete closure of your eyelid, and you have this condition. There is another dystonia. Dystonia is the word that is used for the movement purpose, and dystonia means you have again abnormal neurological movements. You have this is a complete neurological disorder in which you have abnormal, jerky, twitching movements. And if you have the condition, means you have blepharospasm and your lower face and your jaw is also affected, then this is called a Mees syndrome. It is also called cranial dystonia. Condition is aggravated in the morning time when you feel better while you sleep. You have relief while sleep. Diagnosis that cause. Similar ways, there is no exact definitive test for this. The complete detailed patient history, the patient's past history, the patient's selection of the patient's characteristic symptoms leads to the diagnosis. Identification of the characteristic symptoms, we can make diagnosis. So what about the treatment part? Allopathic treatment and homeopathic treatment. In allopathy, yes, there are some oral drugs, and yes, there is a Botox. Botox is a botulinum toxin that is injected in your eye muscles, so that your eye muscles, they are weakened and there is no blinking, there is no closure, right? So you get relief for minimum 3 to 4 months, and that depends on your condition as well. Known as an effective treatment for blepharospasm. Now moving on to homeopathic treatment. Homeopathy focuses on your holistic approach, on your individual approach, means what all symptoms you are having, what is your case, what is your past history. So homeopathy focuses, and these are natural remedies. Mostly they are plant based, so you have no side effect, means that the symptoms you have, we collect all your symptoms, then there is a individual approach for the medicine. Having best effective homeopathic medicine depending on your symptoms and your condition of blepharospasm. Number one medicine I'm having is Sulphur. Sulphur is the medicine that is given when you have, and if you have aggravation in night, so we prescribe you Sulphur. Sulphur is the medicine that is given when you have blepharospasm aggravated in the night. This is the oral dose, oral form of the medicine. You just use 1 or 2 drops twice or thrice before meal regularly till the time you start feeling better. And if you are watching on YouTube, I have provided all the medicines link on the description box, and it doesn't matter you are using any company, use any company available at your place, right? The company color can be changed, but just focus on the medicine name and the medicine form. This is in the liquid form. You can have pills form as well, so you just use pills form medicine, 6 pills depending on the size of the pills can be used. Just have 2 or 3 doses in a day, that's it. Belladonna, you have blepharospasm associated with the eye dryness, means you are having so much of dry eye, with that you are having blepharospasm. So in that case you can use belladonna. Again, start with the lower doses like 6, 12 or 30, and you can go higher. So you can use belladonna in 30 or 200, whichever is available. Just start with the lower. Again, oral form of the medicine. Sulphur is the medicine that is given when you have morning aggravation. Same you have with the blepharospasm, the classical case, means in general you have morning aggravation. So in that case you can use sulphur. Again, 30 or 200 potency, oral form of the medicine. Mug-salt is given in the severe critical cases of the blepharospasm, means you have complete closure of your eyelid and there is a functional blindness. So in that case you can use mug-salt. Again, in 30 or 200 potency, 1 or 2 drops twice or thrice before meal. That way, there are other medicine as well. Crocus is given when you have right eye problem. We have Viola odorata is a rare medicine but given in the blepharospasm cases. We have Silesia, we have Ruta. So these medicine completely depends on the patient. You can use one medicine at a time, and you just start with the lower. The other medicine I'm having is R78. This is again the oral form of the medicine, and there are many medicines mixed together. For if you don't know the exact cause, if you don't know the symptom, then you can use this medicine. R78 oral form, Dr.RUkmani German homeopathic, and in some water 5 or 10 even 15 drops according to your case, and just have it twice or thrice before having your meal regularly till the time to start feeling better. Can help you. If you find this video knowledgeable and informative, please like and share, and don't forget to subscribe my channel. Press the bell icon to get notified. Thank you for watching. Thank you for your support. Stay strong, stay safe. Thank you for watching. Thanks.